this recording, we'll discuss neurotransmitter receptors. So your somatic nervous system, which uses motor neurons to activate skeletal muscles, the only neurotransmitter that we use is acetylcholine. If you think back to our discussion about how skeletal muscle contractions work, we kept mentioning acetylcholine was released into the synaptic cleft and it would bind to the motor end plate, and eventually we got skeletal muscle contraction. Acetylcholine was the only thing we ever mentioned because your somatic nervous system only ever uses acetylcholine, and the effect is always excitatory. Okay, so never, not once, did we talk about releasing acetylcholine at the synaptic cleft and it bound to the motor end plate, and somehow we didn't get, we got negative muscle contraction. I don't even know how to describe it because that's just not how it works. Okay, acetylcholine, when it's used by the somatic nervous system, is always excitatory. Okay, now your autonomic nervous system, your sympathetic and parasympathetic nervous systems. Okay? Pay attention, here we go. Preganglionic neurons always release acetylcholine. Okay? Always. Your postganglionic neurons can release acetylcholine, or they could release norepinephrine, or they could release epinephrine. We have choices here. Okay? Preganglionic, always acetylcholine. Postganglionic, we have choices. Acetylcholine, norepinephrine, epinephrine. Okay? Now, we got another choice, because the effects of the neurotransmitter that is released by the postganglionic neuron, if it's acetylcholine, if it's norepinephrine, doesn't really matter. Okay? Sometimes it's an excitatory response. Sometimes it is an inhibitory response. Okay? So how do we know? How do we know? It all depends on what type of receptor the neurotransmitter binds to. Okay? That's what we're going to focus on. So, this is kind of what it looks like. Okay, so we'll start actually over here. Somatic motor system, this always works the same way. Okay, that one motor neuron is always going to release acetylcholine. It always has an excitatory effect. It always gets us closer to skeletal muscle contraction. Okay, your parasympathetic nervous system, that preganglionic axon is always going to release acetylcholine. In fact, the postganglionic neuron is actually always going to release acetylcholine as well. Okay? But it's not always excitatory. Could be inhibitory. Okay? And then the sympathetic nervous system is really where it gets funky. We could be we're always releasing acetylcholine, the preganglionic neuron. Okay? We could be releasing acetylcholine at the postganglionic neuron. We could also be releasing norepinephrine. Okay. And in fact, if we are sending signals from your good old adrenal medulla, we could even release epinephrine. Okay. Again, some of these can have excitatory effects. Some of them can have inhibitory effects. What's going to be our determining factor? It's going to be the type of receptor that we're going to bind to. So let's talk about receptors. We've got two main categories that we're going to talk about. We've got adrenergic and we've got cholinergic. Okay? Adrenergic, like adrenaline, which is another name for epinephrine. Okay? And we also have noradrenaline, which is norepinephrine. Okay? These come in two varieties. We've got alpha adrenergic, we've got beta adrenergic. Okay? So both of these bind to epinephrine and norepinephrine. Or I should say epinephrine, norepinephrine bind to the receptors. Okay? Cholinergic binds to acetylcholine. And again, we've got two varieties. We've got nicotinic cholinergic receptors and we've got muscarinic cholinergic receptors. Okay? All right. I know. I need some flashcards here, y'all. Okie dokie. Alpha adrenergic receptors. These work with your sympathetic nervous system. These can bind to epinephrine or norepinephrine. Okay. When epinephrine or norepinephrine, when it binds, it causes calcium to enter into the cells. Okay. Hopefully, you remember that calcium is needed for muscle contraction. Okay. We use calcium not only to help contract your skeletal muscles, but calcium is also required for all muscle contraction, including your heart. Okay. So alpha receptors on the heart, okay, if we bind epinephrine or norepinephrine, if we bind those neurotransmitters to alpha receptors on your heart, they have an excitatory effect. They will increase your heart rate. Okay. They will also, if we bind to receptors on your eyes, it will dilate your pupils. Okay. This should make sense if you are using your sympathetic nervous system, if you are working out, whatever. What is your heart going to do? It is going to start beating faster. We need something to help excite the heart. Okay, we're going to use those alpha receptors. Now, here's another fun fact. You also have alpha receptors on your digestive and your urinary organs. But remember, we're working with our sympathetic nervous system, so are we going to want to increase anything for digestion and urination? No. This would be an inhibitory response. Ooh, yeah, I know. Okay, it's getting a little confusing. Okay, so we're saying that we find alpha receptors on the heart, we find them on the eyes, we find them on the digestive and the urinary organs. Okay. But we're still going to have different effects based on what our overall need is. So our sympathetic system, we want to increase a lot of functions like heart rate. Okay, so it should make sense as this is excitatory, but we do also want to inhibit a few functions. We want to inhibit digestion and urination. Okay. All right, beta receptors also work with your sympathetic nervous system. Because they're adrenergic, again, we're going to bind to epinephrine, norepinephrine. Okay. When we bind the epi or the norepi, we have increased cell metabolism here. Okay. Beta receptors are also going to excite the heart cells, lung cells. This will increase heart rate. It'll actually also increase your blood pressure. This will cause bronchodilation in your respiratory passageways. Okay. This causes increased blood flow to your muscles. Okay, if we can increase blood flow, we can get more oxygen and nutrients to your muscles, so this increases cellular metabolism. Okay. All right. This is a review slide, obviously, but I do want to point out that we've mentioned a few of these receptors. We've mentioned a few of these what do you call them, responses. I don't know why that was hard, but I don't want you to go home and memorize any of this. Okay, you are not expected to know all of this. Okay, we didn't break it down into alpha 1 and alpha 2. We didn't break them down into beta 1 and beta 2. Okay, this is just kind of an FYI. Okay, just kind of FYI. Now let's do cholinergic. Okay. Remember, we do ultimately have two types of cholinergic. First, we're going to do nicotinic. Okay, so your nicotinic receptors can work with your sympathetic system, your parasympathetic system, and I'm going to blow your minds, they can also work with your somatic nervous system. Science. Okay. Now, since these are cholinergic, they do bind acetylcholine. Okay. When the acetylcholine binds to these nicotinic receptors, if we're talking about receptors on the digestive organs or the urinary organs, okay, this will lead to an excitatory effect. This will lead to EPSPs. Okay. So these nicotinic receptors excite digestion and urination activities. When are we going to excite digestion and urination? Those signals obviously would be coming from the parasympathetic nervous system. Okay. Nicotinic receptors, again, can also be found on skeletal muscles. They'll still bind acetylcholine. And you know, if we send acetylcholine to your skeletal muscles, what are we going to do? I'll come back. We are going to have skeletal muscle contraction. But just keep in mind that is your somatic nervous system. Okay, it's not autonomic nervous system. It's just kind of a fun FYI. These are the same types of receptors. You get the same result. Okay, it's just a completely different part of your nervous system. All right, our last category is muscarinic receptors. These work exclusively with your parasympathetic nervous system. Still going to bind to acetylcholine. Okay. When we are binding acetylcholine to these receptors on your digestive and urinary organs, again, we are exciting those organs. Okay. So same effects as what we just saw. Okay. But you will also find these receptors in places like your heart and the bronchi of your respiratory passageways. If acetylcholine binds to your muscarinic receptors on your heart and your bronchi, this would be an inhibitory or an IPSP response. Okay, we would be trying to slow your heart rate down. We would constrict your bronchioles back to their normal diameter.